Coagulation, secondary hemostasis. Primary hemostasis is the formation of a platelet plug. Secondary hemostasis involves a series of reactions involving clotting proteins. This results in the formation of fibrin, a solid protein, which forms a meshwork in and around the primary hemostatic platelet plug, producing a stable physical barrier, or clot, to escaping blood. The clot is temporary, lasting until the vessel's endothelial wall is repaired. Both primary and secondary hemostasis are necessary for normal clot formation. Deficiencies in the clotting factors of secondary hemostasis result in ecchymosis and deep hemorrhages into joints and body cavities. Plasma clotting factors. Coagulation factors circulate in the plasma as procoagulants, or zymogens. Clotting factors are proteins except for calcium and thromboplastin. When activated, they lead to the formation of a solid fibrin clot. Many of the coagulation factors act as enzymes when activated. Enzymes are called proteases because they work on proteins. The function is to cleave peptide bonds. They are referred to as serine proteases because they have serine as part of their active enzymatic site. Activated clotting factors are indicated by the letter A following the Roman numeral. Factor 13 is a transaminase. Cofactors are proteins that accelerate the enzymatic reactions in coagulation. They are factor 5, factor 8C, and high molecular weight kininogen. Activation of clotting proteins. Clotting proteins are activated by substances released at the time of blood vessel injury. Clotting factors are assigned Roman numerals in the order of their discovery. The mechanism involves activation of a clotting factor or protein, which activates another clotting factor in a cascade system. Factors are formed in the liver except for the von Willebrand portion of factor 8, which is produced by endothelial cells and megakaryocytes. Factor 5, or labile factor, and factor 8, anti-hemophilic globulin, are labile. They do not remain in the plasma for long periods of time and are not found in aged plasma. The coagulation system is divided into the extrinsic, intrinsic, and common pathways. The intrinsic system includes prekallikrein, high molecular weight kininogen, factor 12, factor 11, factor 9, and factor 8. The extrinsic system includes factor 3, or tissue factor, and factor 7. The common pathway includes factor 10, 5, factor 2, or prothrombin, factor 1, or fibrinogen, and factor 13. The extrinsic system is external and is activated by vascular injury as a result of the release of tissue thromboplastin, or factor 3, into the circulation. It's measured by the PT, or prothrombin time test. It includes factor 7. The intrinsic system is internal. It's activated by surface contact. The intrinsic system is measured by the APTT, or activated partial thromboplastin time test. The factors included in the intrinsic system are prekallikrein, high molecular weight kininogen, factor 12, factor 11, factor 9, and factor 8. Activated platelets provide a phospholipid, or platelet factor 3, needed for factor 9 conversion. Factor 9 and factor 8 activate factor 10 to form factor 10A. Factor 10, in the presence of factor 5, calcium and phospholipid surface, converts factor 2, or prothrombin, to factor 2A, or thrombin. This converts factor 1, or fibrin, to fibrinogen. Factor 13 stabilizes the clot. The common pathway is activated by the intrinsic and/or extrinsic pathway. It includes factors 10, 5, 2 or prothrombin, 1 or fibrinogen, and 13. Fibrinogen consists of an alpha chain, a beta chain, and a gamma chain. Fibrin monomers polymerize in a side-to-side and end-to-end orientation. They are held together by weak hydrogen bonds to form fibrin. Factor 13, which is activated by thrombin, and calcium 2+, catalyze the cross-linking of the fibrin monomers, polymerizing soluble fibrin monomers to a stable fibrin clot. Thrombin activates factor 9, activates factor 13, and large amounts of thrombin limit further clotting. Factor 11 activates the fibrinolytic system by its interaction with plasminogen proactivator, probably kallikrein. Kallikrein generates plasmin from plasminogen. Kallikrein is also involved in the activation of the kinin system and is formed by the high molecular weight fibrinogen cleaving into small biologically active fragments called kinins. It activates the fibrinolytic system and the complement system, probably through C1 and C3, and serves as a chemostatic factor for the necrophils and monocytes. Clotting factor groups. The fibrinogen family, or factor 1, 5, 8, and 13, are all consumed during a clot. The prothrombin family are all vitamin K dependent. They are factors 2, 7, 9, 10, C, and S. Vitamin K is a fat-soluble vitamin ingested in the diet and made by intestinal bacteria. Vitamin K is necessary to attach a COOH or carboxyl group to glutamic acid residues of the clotting factors. This allows the factors to bind to calcium and the surface of activated protein, which is necessary for function of the coagulation pathway. The contact family is factors 12, 11, prekallikrein, and high molecular weight kininogen. Serum or plasma products. Adsorbed plasma. BaSO4 is added to plasma. It absorbs or removes the vitamin K dependent factors. Aged plasma. Lacks labile factors 5 and 8. Serum. Lacks fibrinogen group and factor 2. The contact group consists of factor 12, 11, PK, and HMWK. They are present in the serum and in stored plasma and in adsorbed plasma. The prothrombin group is factor 2, 7, 9, and 10. They are vitamin K dependent and are consumed during coagulation, except for factor 2, and present in serum, except for factor 2. They are also present in stored plasma and adsorbed by BaSO4. The fibrinogen group is factors 1, 5, 8, and 13. They are consumed in the clot. They are not vitamin K dependent and are present in adsorbed plasma.